let you know that vaccines are available to anyone over 16 who wants one. The wait is over and your time has arrived. As of March 29th, Governor Abbott made everyone ages 16 and older eligible to receive a vaccine regardless of occupation or health status. No longer do you need to be in phase 1A or 1B. Currently, people ages 16 and 17 years old can only receive the Pfizer vaccine. Pfizer, Moderna, and Johnson & Johnson vaccines are available to people ages 18 and up. Now, here's some important information regarding the number of vaccinated people in our state. As of April 5th, 16.5% of all Texans are fully vaccinated, according to the Texas Department of State Health Services. Even more encouraging news is that over 25% of people aged 16 and older are fully vaccinated in Nueces County. To put that into some perspective, that means 1 in 4 people in Nueces County are fully vaccinated. This is great news for our area. People who want a vaccine have access to it through our city county health district and other providers. We know that people are also asking about herd immunity. The population in Nueces County is approximately 373,000 people, and of that population, 284,000 of them are ages 16 and over. With the City County Health District averaging about 7,000 vaccines per week, we could achieve 70% immunity in Nueces County by August of 2021 for people in the age group of 16 and up. This is a conservative estimate based on the data aggregated by Accenture Data Services. With the combined efforts of other providers in the health district, maybe we could see herd immunity even sooner. This is also great news. In a matter of months, the outlook of the pandemic could look completely different if we get vaccinated. And again, this is always voluntary. This week, the health district hosted 6 vaccine clinics and 4 pop-up clinics in the community so far, including 1 pop-up clinic in partnership with the Boys and Girls Club. The health district is bringing vaccines to the community through these pop-up clinics and our community partnerships. Access to vaccines are easier and faster than ever before. It should be noted that wait times at our health district vaccine clinics have dramatically decreased since January. If you are pre-registered for a vaccine appointment online and you bring your QR code with you, the total wait time from start to finish could be as little as 30 minutes or less. If you register on site, the total wait time could be under an hour. We really want to encourage you to pre-register, get your QR code, and get the vaccine if you want one. You can register online at cctexas.com/vaccine registration at any time. The online registration portal is open 24/7. Or you can call 361-561-1101 to register by phone for a vaccine clinic Monday through Saturday from 10 a.m. to 5 p.m. In more exciting news, on Tuesday, the health district administered the single-dose Johnson & Johnson vaccine. Patrons who participated in this vaccine clinic will not have to return for a second dose, making the Johnson & Johnson vaccine a convenient option. For this reason, the Johnson & Johnson vaccine has been identified as an ideal vaccination for hard-to-reach populations. Currently, the city is in the planning process to launch the Help the Homeless, or HOH, vaccine program. We are working with different homeless services providers to identify the best way to reach these populations to offer the COVID-19 vaccine. As shipment of Johnson & Johnson continues to be anticipated, please know that your city and your health district are working to ensure that all populations have access to the vaccine. Importantly, the Save Our Seniors Homebound program will be opening the registration hotline tomorrow, Friday, April 9th at noon. Seniors and homebound residents can call 1-888-728-0018 to register. That's the number right there. English and Spanish operators will be standing by to assist you. As of this week, the state of Texas has announced that the Corpus Christi model for the Save Our Seniors program is being used in 107 counties throughout Texas. Just a quick note here, this program is very important to Mayor Guajardo. Vaccinating all homebound citizens, all senior citizens through our Corpus Christi Fire Department is so essential to her. The SOS model throughout Texas is on track to vaccinate over 2 million senior citizens. All in all, our goal is very important. Mayor Paulette Guajardo wants to provide a vaccine to everyone who wants one. For that, we need you. We need community participation. The faster we're vaccinated, the closer to herd immunity we will be, and we will all be better off for it. Now we will pause for a brief Spanish translation and hear from Nueces County Judge Barbara Canales. Thank you.
Kristen Cavazos, la directora de comunicaciones de la alcaldesa Paulette Guajardo, dio el reporte de hoy. Las vacunas están disponibles para cualquier persona mayor de 16 años que desee una por parte de la compañía Pfizer, mientras que las vacunas Moderna y Janssen es solo para mayores de 18 años, no importa su estado de salud o empleo. Al 5 de abril, el 16,5% de todos los tejanos estaban ya completamente vacunados, según el Departamento de Servicios de Salud del Estado de Texas. Más del 25% de las personas mayores de 16 años están completamente vacunadas en el condado de Nueces. O sea, 1 de cada 4 personas en el condado de Nueces están completamente vacunados. Esto significa que han recibido las 2 vacunas. En cuanto a la inmunidad colectiva, la población en el condado de Nueces es de aproximadamente 373,000 personas. De esa población, alrededor de 284,000 personas tienen 16 años o más. Con el Distrito de Salud de la ciudad y el condado con un promedio de aproximadamente 7,000 vacunas por semana, podríamos lograr un 70% de inmunidad colectiva en el condado de Nueces para agosto del 2021, para las personas de 16 años en adelante. El panorama de la pandemia podría ser diferente si una cantidad suficiente de nuestra población se vacunara. Nuevamente, esto siempre es voluntario. Esta semana, el Distrito de Salud llevó a cabo 6 clínicas de vacunas y 4 clínicas emergentes en la comunidad hasta ahora, incluyendo una clínica emergente en la asociación con el Club de Niños y Niñas. Queremos exhortarlo a que se inscriba para recibir la vacuna a la dirección www.cctexas.com/vaccine registration en cualquier momento. El portal de registro en línea está abierto las 24 horas del día, los 7 días de la semana. O puede llamar al 361-561-1101 para registrarse por teléfono de lunes a sábado de 10 de la mañana a 5 de la tarde. Es importante destacar que el programa de confinamiento en el hogar, Save Our Seniors o SOS, abrirá la línea directa de registro mañana, viernes 9 de abril al mediodía. Las personas mayores y los residentes confinados en sus hogares pueden llamar al 1-888-728-0018 para registrarse. Los operadores en inglés y en español estarán listos para ayudarlo. El modelo SOS está en camino de vacunar a más de 2 millones de personas mayores en el estado de Texas.
Thank you and good afternoon. Barbara Canales, Nueces County Judge. You just got a lot of great information, and I'm going to see if I can supplement that. We had another great week of vaccinations, and you just heard the exciting news that we have mathematically calculated how we can achieve herd immunity in Nueces County if we all do our part by the end of the summer. Now, I'd like to reflect on where we've been and let you know what's coming up in the next few weeks. Our city-county public health department is designated, as all of you know, as a hub. And when vaccines were in very limited supply, hubs were the very first and so often the only providers to get vaccines. And as we stood up our hub and set up our mega clinics, first at the Richard Borchard Fairgrounds and later at the American Bank Center in downtown Corpus Christi, our goal was to get as many qualified people vaccinated as quickly as possible. And we did. And I'm incredibly proud of the efforts of this team, City County Health Department, to distribute vaccines as a state of Texas designated hub. And with that charter came the duty to serve not just the residents of City of Corpus Christi and not just the residents of Nueces County, but to serve our region, the Coastal Bend. And I'm often reminded when I'm traveling to Austin during this legislative session what it means to be a leader in your region. What it means to not put yourself first, but to put the collective region first. This is why we're admired in South Texas. This is a duty that we carried out with a tremendous sense of purpose, and our efforts reflect the best of the community spirit of Nueces County. We're not always going to agree on every issue, but when it comes to COVID-19 and our response, we do reflect the best of what we can be together. I was looking back at letters, that I have in my file, and I looked back at January 15th, and that seems like an eternity, but it was 3 months ago. And this is a paraphrase of what I wrote, probably delivering at this very podium. I said that large clinics are more efficient and small clinics are more convenient. I said that when vaccines are scarce, large clinics are the only way that we know collectively to get large numbers of people vaccinated efficiently. And other providers like Driscoll, which is a dedicated hub, and Christus Spawn Health System, which is a large non-hub provider, they've been able to tap into the expertise of the city and the county's health department to set up smaller clinics to reach people in the city, on the island, and in the country, in the rural areas. And we've worked with groups to help set up clinics. And just like there is an SOS program inside the city limits, there is a complete regional homebound program going on outside the city limits in the rural areas. And if they can get people to come, we are eager to bring vaccines, and we have, on the island, Port Aransas, in Driscoll, and outside in Robstown. We now have a very reliable and predictable supply of vaccine. Completely changed circumstances. That was just 3 months ago. And now this third vaccine option, Johnson & Johnson, for the very first time you heard earlier, that we offer 3 types of vaccine in our community: Pfizer, Moderna, and Johnson & Johnson. And this increased supply of vaccine means that we just don't have to have mega clinic operations like you've seen at ABC, American Bank Center, and at the fairgrounds. Now you're going to see smaller clinics come closer to you. We're pivoting. We're adapting. We're evolving. And you're going to see the supplies in places even become more abundant and convenient, like H-E-B and CVS. These are the places that you normally go for the pharmacy. You even get your flu shots there. You're also going to start seeing vaccine in satellite healthcare clinics, maybe like WellMed or Conviva, Coastal Bend Wellness, Men's and Women's Health Clinic. Maybe it's even a place where you see your primary care physician. One of the biggest complaints that I've heard, and it's a valid one, it's very valid, that our clinics happen when we get notice of our vaccine shipment. We often can't give you that week or two ahead notice. And we love going to the fairgrounds for stock shows, roping competitions, country peddler, at least I do, cheer and dance championships, monster truck rallies, and the like. And we love going to American Bank Center for concerts and rodeos and Islander basketball games. But you aren't going to either the fairgrounds or the American Bank Center in the normal course of your day. I know that. We know that. That's why today I'm excited to make the announcement that we are going to open up a standing vaccination clinic with regular days and regular hours at La Palmera Mall. When the mall is open, the vaccine clinic will be open. The mall is open Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and Sunday, every day that ends in Y, and we'll be there too. And starting next week, and Annette is going to kind of give us that magical day, but we're going to aim for the middle of next week. We'll give you more updates through press releases and media releases, that La Palmera will be a clinic waiting for you. It'll be a walk-in clinic. You won't need to pre-register. It'll also be a source of education. If you're walking by and you're not ready, but you need information, you're going to be able to get it there. And we're going to have vaccine. And we're hoping, at least in the beginning, we'll make sure that we have at minimum, 100 vaccine doses every day from the hubs that are going on from other parts of our community. We anticipate short wait times, and we anticipate that we could possibly administer 1,000 vaccines a day. We also can help our other providers. As Driscoll makes their transition or Spawn makes their transition, as we inch our way towards herd immunity, we could possibly help them out as well at this great location. And we'll look for others as well. I'm extremely and actually just over the moon about setting up this standing clinic. And I want to thank La Palmera, their GM, Amanda Sanchez, who reacted like that when we called. And so it's a place that most of us might go anyway. It's a place that most of us don't mind spending time in. So whether you're shopping or dining or getting your free, life-saving COVID-19 vaccine shot, it sounds like it's a good day to be at La Palmera next week. And also, I'm being corrected here by we may not be open on Sunday. But if we can staff it, and we can get arms that need vaccines on Sunday for those folks that are working Monday through Saturday, you know that when there's a need in this community, City County Public Health is going to deliver it. So as we go forward, La Palmera will be part of the many tools we have to fight back against this horrible disease. You know how I like football, so it's got to be offense in addition to defense. That applies for basketball too, but there will be an option that's right for you. And whether it's at this mega clinic that we're offering for the rest of the week, or a one-day clinic near your home, at the standing clinic at La Palmera, or your local pharmacy, there's no doubt that there is an option that's just right for you. And I want you to know, and I'm going to deviate here from the script, that I listened very carefully to the communications that were relayed here earlier. It is your turn. You don't have to wait. But some of you are choosing to wait. And I want to tell you that I always try to shoot straight, that I'm a little worried about that. Because you see that mathematical computation, getting to herd immunity that you heard earlier that Accenture had delivered to both the mayor and myself earlier this week. It's a real number, but it's got a variable. And that variable is that we got to keep delivering a lot of vaccine like we've been doing. And what I'm seeing, I don't like. We're slowing down. And as we slow down, we're going to make that calendar stretch longer and longer. So we need to make certain that we're doing our part in encouraging people who need more information, that's okay, to get that information, get that education they need. Because the only way to protect our community is when we achieve that herd immunity. So a lot of people have asked about the differences between the three vaccines. And I would ask you to address your questions with your doctor or a qualified healthcare professional, and we can help you get those from City County Public Health, that information. And I would also ask that if you're going to look for information, look for trusted sources of information. Look for the CDC's website. Look for the Texas Department of State and Health Services website. Look to the City County Health website. These are trusted sources. Don't be fooled by sources that are not trusted. They can give you the facts to have the right discussion that you need so you can make the best choice, an informed choice for yourself. The standing clinic is a tremendous milestone for our community, and I hope you take advantage of it. I hope you come visit with us. We're going to make certain that we also have accessibility for those residents who have disabilities, and we're going to make sure we even have staff that can assist those with disabilities there. So I hope it's very easy now for you to see that whether it's coming from the city or the county messaging, that you can get your vaccine anytime without a wait. I hope that you make getting a vaccine a priority. I hope that you say, why not today? I've been talking to a lot of young people, I suppose with the holiday and so many of my children home, they're waiting. They're waiting and they're allowing others to be first. It's very noble. It's very important to allow our vulnerables first. But as you can see, the way to protect us is to get vaccinated. So if you're holding back, or if you're young and listening to this on Facebook, please let me say it for the last time today. You aren't taking vaccine away from anybody who needs it more. It's not just your turn. We need you. We need you to protect everybody that you love. Let's all be safe together. Let's continue to play defense and offense. And I hope that we have more news with more standing clinics next week. In the meantime, I'll see you next week. and perhaps at La Palmera Mall.
Cuando comenzamos con las clínicas de vacunación, nuestro condado fue designado como un centro de distribución de vacunas y así lo hemos hecho. Estoy muy orgullosa del trabajo de los empleados de salud del condado de Nueces. Existen otros proveedores de vacunas como el Hospital Infantil Driscoll y el sistema SPON. Ellos han aprendido de nuestros empleados del Distrito de Salud y así como dentro de los límites de la ciudad, hemos también podido llevar a cabo otras clínicas en áreas más pequeñas como la isla de Port Aransas. Y ahora con una tercera opción, con la vacuna Janssen, va a haber otras clínicas más pequeñas y cada vez que haya más vacunas podrá obtenerlas mediante otros proveedores, como las farmacias independientes. Y aunque nos gusta ir a lugares como el Centro de Exposición en Robeston o el Centro ABC, vamos a tener una clínica ahora en el Centro Comercial La Palmera, la cual va a contar con el horario del centro comercial, así podrá usted tomar su vacuna sin tener cita. Esa información la vamos a dar a conocer mediante un comunicado para decirle del primer día en que se va a llevar a cabo la clínica de vacunación en el Centro Comercial La Palmera. Esperamos ahí contar con al menos 100 vacunas diariamente y esperamos tener los tiempos de espera que sean cortos, así va a ser más fácil tomar su vacuna mientras va de compras. Posiblemente los días domingos esté cerrado, pero para obtener la vacuna lo podrá hacer de lunes a sábado. Mucha gente ha decidido esperar en no obtener su vacuna esperando lograr la inmunidad colectiva, pero eso no va a ocurrir si más personas deciden esperar en recibir su vacuna, por lo que es importante obtener información de lugares con información veraz, como los Centros del Control de Enfermedades o el sitio del portal de salud de la Clínica de Salud del Condado de Nueces, y no en lugares que no cuenten con información confiable. Espero que haga de la vacuna su prioridad y la tome lo más pronto posible. Esa es la mejor manera de obtener protección en contra del virus.
Annette Rodriguez, Public Health Director. So we're going to start with the Nueces County COVID-19 statistics. And so you see the bar graph that we start with. And on the right side, the week ending in April 1st, 2021, there were 509 COVID cases in Nueces County. And then this week, from April 2nd to today's date, April 8th, there's actually 426 COVID cases this week, which is 83% less than last week, which is very good. So thank you to the community for doing your part to see that these numbers come down. Next slide. So the donut diagram basically shows the total number of COVID cases, all inclusive, is 40,000. So we've reached the 40,000 mark, 205. We've actually exceeded it. 38,383 people have recovered. And for active cases, we have 1,067. So we're still over the 1,000 number for people that have active COVID-19 here in Nueces County, and then 755 deaths. Again, the deaths are cumulative, so you will see them continue to rise. For hospitalizations, you can split it and look at one side and then the other side, and it actually looks like this side, when you see the 33, the 38, the 41, which is this week, these are better numbers. The problem that we have with this particular graphic is that if you look from 38 to 41 to 44 to 50 to 52, those are hospitalizations this week, and they're going up. And so they're going the wrong direction. That's something that you have to pay very close attention to, because when numbers are going up, usually cases have gone up, then numbers go up, and then everybody knows that ICU patient numbers go up as well, and sometimes even deaths will rise. These are the ICU patients. On the other hand, you're seeing that you see a downward trend this week. So you see 22 at the far end, and then you see 13 for today. And if you look at April 2nd, which is right in the middle there on the 13 where it dips down, that's the beginning of the second week for ICU patients. And it's 13, 14, 15, 16, 17, back down to 16, and then 13 today. So ICU patients are lower this week, but we also know that they're a lagging indicator, and so you have to keep an eye on those as well. The number of deaths, again, 755 people that have died in Nueces County. That's a lot of individuals. You know, just over a year ago, COVID-19 was not even on our reportable communicable disease, and now it's actually the third leading cause of death, not only for Nueces County, but in the United States. And then the last statistical slide is going to show fatalities. And if you look at last week, you see a lot of gaps, which is really good news. That means there were no deaths on those days. So a total of 3 deaths last week, but then you see a total of 6 deaths this week. And we know that it's also a lagging indicator, the number of deaths, so you have to be wondering, why are the deaths going up? So what's happening is something out there that we need to be worried about. Our cases still are not in the single digit. They're still in the double digits, so we know that they could go up to the triple digits very easily. So again, just to remind people to be very careful still. We're still not out of the woods quite yet, and I know everybody has said that. So the health district does have some exciting news, though. As of yesterday, the health district, along, of course, with our IT staff, the city's IT staff, and other volunteers, we've administered more than 100,000 doses of the COVID-19 vaccine, and that's just the health district hub provider. But we aren't done yet. There is still only around 25% of the population in Nueces County that are fully vaccinated. And again, the number we're trying to get to is closer to 80%. So from 25% to 80% is quite a span still that we need to accomplish. The health district will continue to host mega vaccination clinics and is working on setting up more clinics in the near future to have more consistent clinics where citizens can easily find us and get vaccinated as soon as they are ready to do so. As the judge mentioned, La Palmera Mall, and that should be starting next Tuesday, and we will be vaccinating at La Palmera Mall on Sunday as well, and it'll be regular mall operation hours. So please don't wait to get vaccinated. Now we do have vaccines available. We mostly have Moderna at the health district. We also still currently have Johnson & Johnson, but Driscoll's hub has Pfizer available. So any of the 3 vaccines that are approved through the EUA, if you're wanting to get one of those, you can go to any of these hubs and get vaccinated. I fear for those that are waiting will end up hospitalized from this virus, so please don't wait. Vaccines are becoming more abundant and are open to anyone 16 years of age and older. As such, our registration process too has had to evolve. So let me go over it with you. So everybody's asking, how do I register for a clinic? So if you're wanting to go to one of the health district's hubs, and sometimes we're at Richard Borchard Fairgrounds, sometimes we're at American Bank Center, and now we're going to be every day at La Palmera Mall starting next week. There's 3 different ways you can register, and one is by going to the cctexas.com website. You can click on vaccine information and then vaccine form. It's a large blue button. You can't miss it, and you just pre-register. Very basic information, your name, your demographics, your date of birth, and then if you're allergic to COVID-19, if you're pregnant, and there's a few other questions about antibodies and vaccinations. Once you hit submit, you get a QR code. You bring that to your clinic, and we check you in very quickly. You can also call the 361-561-1101. That's the health district. And we can register you for you if you don't have a computer or you're struggling to get registered. Some people get bogged down on the date of birth. It's 2 digits for the day, 2 digits for the month, 2 digits for the day, and then 4 digits for the year. So some people are trying to put in 2 digits, and it doesn't give you an example. It has to be the 4 digits. So, and lastly, you can just come. If you want to come to one of our clinics at Richard Borchard or American Bank Center or now at La Palmera Mall, it's where Charming Charlie's used to be, over there close to Grimaldi's. That's where we'll be located. If you want to just come, we can help you register right there on site. Of course, it's going to be a slower process than if you already pre-registered before you came. That's going to be a real quick, less than 1 minute to look at your QR and get you in to get you vaccinated, and then you wait your 15 minutes. So people also ask us, when do you have clinics? So I'm happy to say right now we're working with the city IT's group here, the Department Information Technology, and they're actually working on putting up a link that shows where our clinics are. The reason we didn't have them up before was because we didn't have very much vaccine. Now that we have more vaccine, we can actually set dates and we can tell you where we're at, and then you can come to those dates. So we will be having a very big clinic this Saturday at American Bank Center from 9 a.m. to 3 p.m., and it's a walk-through clinic. So if you've had your first dose at one of our health district clinics, or if you've had a first dose from somewhere else, it doesn't matter where, from out of state, from a neighboring jurisdiction, and you're needing your second dose, this is a great time to come to American Bank Center this Saturday between 9 and 3, and we can get you that second dose of Moderna. So we're also going to have some J&J available on Saturday. The state is really pushing that within 5 days, we make sure that we get that J&J into people's arms. So please help us with that. If you know of people that want one dose and they're done, it's the J&J vaccine, send them over to the American Bank Center on Saturday, and we'll vaccinate them for J&J as long as we have vaccine available. Another question is, can I register for a specific clinic? And I'm happy to say yes. So beginning today, we just started that. You can actually go in, and when you pre-register, you can register for Saturday, or you can register for next Tuesday or for next Wednesday. We're not going out very far right now. We're only going out about a week. But what was happening was we would reverse alert you and tell you to come on Tuesday, and then you would call us back and say, Tuesday's not a good day. And so we're trying to change those times. And so it's so much easier now. You don't have to, we're not going to tell you when to come. You look at the clinics that are available, and then you come and get vaccinated for your first or your second dose. Do I have to register for a second dose? So the answer is no. If you've already come to the health district and you've already come for your first dose, that means you're already registered. The only thing you have to do, or you should do, is we're going to send you a magic link, and you have to click on it. You have to actually touch it, and it opens up, and then it asks you a few questions. You're still not pregnant. You still haven't taken a vaccine in the last 14 days. You say no, no, no. You say submit. You get your QR. You're done. The only people that do have to pre-register for a second dose are people that have never come to the health department before. So it's really like it's their first dose, so they do have to pre-register, and we can still give them their second dose. Can I name the specific brand of vaccine I am wanting when I pre-register? Currently, no. Not at this time. We don't have that yet, but we are looking into that. We're hoping as we have more vaccine, and maybe one day we'll have Moderna, J&J, and Pfizer. And then when you go into pre-register, you can pick, I want J&J, I want to be there on a Wednesday, and I want to go to the American Bank Center. So right now you can't specify what brand, but you can definitely tell us what clinic you want to be at. Do I have to have my QR when I come to the clinic? And I think I've already mentioned it. No, you don't, but it is much, much faster if you do have your QR. If you don't have it, we can look you up by name. Sometimes there's a real common name like John Smith. It's going to take the computer a little longer to find all the John Smiths and to figure out which one's you. So we might have to ask you your date of birth. We might have to ask you your phone number. But if you have your QR code, it picks it up immediately because it's a unique code specifically for you. Can I take 2 different vaccines? I've already taken Pfizer, and now I'm wanting Moderna. The recommendation is that you take the same brand for both doses. So for Pfizer, you take one, and then 21 days later, you take another Pfizer, the second dose. For Moderna, you take your first dose, and then 28 days later, you take your second dose Moderna. The only exception is if you're allergic, severely allergic to the first vaccine. If you have a severe allergic reaction, which could mean, you end up in the hospital, but you really want to get that second dose, talk to your physician because they are saying that you can get Johnson & Johnson as your second dose if you had a severe allergic reaction to your first dose of Pfizer or Moderna. How long do I have to wait if I received monoclonal antibodies? The recommendation is that you should wait at least 90 days before you get vaccinated. Remember, monoclonal antibodies are really boosting your immune system, and then the vaccine also boosts your immune system, so wait at least 3 months before you get your first vaccine. How long do I have to wait if I've had COVID-19? You actually don't have to wait. You only have to wait until you recover. Once you're recovered completely from COVID-19, you can now get vaccinated. It used to be that they wanted you to wait 3 months, but that has since changed, the CDC guidelines, recommendations, and so now you can get your vaccine if you've had COVID-19 once you've fully recovered. Question, how long do these vaccines give you protection? So this is a novel virus, so we're still learning about the virus, but they're doing a lot of studies. They call them real-world studies. They're actually looking at society to see who's getting sick, how long has it been since they've taken their doses. And we know that these vaccines work and protect you for at least 6 months. And we know that these vaccines protect you against severe illness and hospitalizations. So that's really good news. And as we learn more and that time extends, we'll let you know as well. Do these vaccines protect against the variant? That's the big question. And so what I'm going to say is from everything that I've read and I've studied, from all the scientists and all the articles and information out there, yes. For Pfizer and Moderna, they are still very effective against the UK B117. But we are seeing that they are not as effective against the South African, the B1351 variant. But we do know that J&J is effective against all 3 variants at this time. I think that's really important because right now in Texas, we have over 1,400 cases of the variant B117. We were notified a few days ago that we had 8 additional cases in Nueces County of the variant B117. Most cases in the United States, about 90% of them are all B117 at this time. So, we're seeing that it's changed from the original COVID-19 to now to the variant, the B117, like we saw, in the UK and a lot of other places. So as far as the B1351, the South African, and the P1, the Brazilian, in Texas, there's less than 10 cases of each of those, but it only takes 1 case of that variant to spread throughout the state of Texas and throughout the United States. And so we're asking you to still be very careful, wear your mask, social distance, wash your hands often. And the last thing I'm going to end with is remember that children under the age of 16 have not been vaccinated. I think this is very critical information. I think we're all so excited about adults and getting vaccinated and being able to see extended family members that we're forgetting that these children, they're going to school, they haven't been vaccinated, so they can still pick up COVID-19 and they can still spread the disease. The trend is currently that we're starting to see more children getting COVID-19, and we really don't want to end up losing a child to this horrific disease. Being hospitalized or worse yet, losing a child to COVID-19 would be the worst thing that anybody could experience. So please protect your children, stay well, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 82 casos confirmados por el coronavirus. El día de hoy no se reportan fallecimientos, pero a la fecha los fallecimientos totalizan 755 personas. El Distrito de Salud ha administrado más de 100,000 dosis de la vacuna contra el coronavirus, haciendo así alrededor del 25% de los residentes completamente vacunados. Para obtener inmunidad colectiva se necesita alrededor del 80% de las personas vacunadas. El Distrito de Salud está llevando a cabo megaclínicas y continuamos llevando a cabo clínicas más pequeñas, por lo que le pedimos que no espere y se vacune lo más pronto posible. Las vacunas cada vez están disponibles más rápidamente para personas mayores de 16 años. Para registrarse puede hacerlo en línea en la dirección www.cctexas.com/vaccine registration o llamando al 561-1101 o llegue a la clínica y ahí lo vamos a ayudar a registrarse. Este sábado vamos a llevar a cabo una clínica en el centro ABC de 9 a 3. Esto es para segundas dosis. No olvide llevar su tarjeta de vacunación. También le queremos recordar que los niños menores de 16 años aún no están recibiendo su vacuna, por lo que le pedimos seguir tomando todas las medidas de precaución con ellos.
Thank you. Seeing that there are no other questions today, thank you, and we will see you next week for our presser.